Several tools have been designed to assess and evaluate caregiver burden. The Caregiver Strain Index, the Zarit Burden Inventory, and the Caregiver Burden Scale. The Caregiver Strain Index is a tool designed to identify families with potential caregiving concerns. It is a 13-question, self-administered tool that measures strain related to care provision. There is at least one item for the following domains: employment, financial, physical, social, and time. Positive responses to 7 or more items on the index indicate a greater level of strain. The higher the score on the MCSI, the greater the need for more in-depth assessment to facilitate appropriate intervention. This instrument can be used to assess individuals of all ages who have assumed the role of caregiver of an older adult. The Zarit Burden Inventory, also known as the Zarit Screen, measure of caregiver burden, is the most widely screening tool used for caregiver burden. Originally designed and tested in 1930, its original 29 questions have been reduced down to a short and simple 4-item screen, proven to be valid and reliable for its designated use. It is self-administered by the caregiver. A score of 8 indicates high burden, and intervention may be indicated. The Caregiver Burden Scale measures 3 domains. The first domain is identified as patient needs. The second domain is defined as caregiver tasks. The third domain is identified as caregiver burden. This domain identifies where the patient needed assistance and the caregiver reported that providing the assistance was stressful. By obtaining a measure of the caregiver's perceived burden associated with each of the 15 possible tasks, we are able to narrow down the source of stress in a way that could lead to effective interventions. The North American Nursing Diagnosis suggests the following recommendations for assessing the ongoing needs of caregivers. Establish a relationship with the caregiver and the care recipient to facilitate assessment and intervention. Assess caregiver-care recipient relationship. Dysfunctional relationships can result in ineffective, fragmented care or even lead to neglect or abuse. Assess family communication pattern. Open communication in the family creates a positive environment, whereas concealing feelings creates problems for caregiver and care recipient. Assess family resources and support systems. Family and social support is related positively to coping effectiveness. Assess caregiver's appraisal of caregiving situation, level of understanding, and willingness to assume the caregiver role. Individual responses can determine the personal meaning of the situation. For some, caregiving is viewed as duty. For others, an act of love. Assess for neglect and abuse of care recipient, and take necessary steps to prevent injury to care recipient and strain on caregiver. Safe and appropriate care are priority nursing concerns. Assess caregiver health. Even those strongly motivated to perform this role of the caregiver, the person may have physical impairments such as vision problems, musculoskeletal weakness, limited upper body strength, or cognitive impairments that affect the quality of caregiving activities.